Hi, I'm Dr. Steve Walsh, and I'm the optometrist here at the center. And if we haven't crossed paths yet, I really look forward to taking care of you after your procedure's done. We're going to talk a little bit about the postoperative instructions that you'll need to have for your Lasik procedure that you're going to have today. And we're so excited to have you as a patient and want to make sure that you feel comfortable and confident with using your medications and your drops after the procedure's done. So let's get started. So first of all, I want to talk about the medicine drops, and you should have two prescriptions. One's for an antibiotic eye drop. We typically use tobramycin, which is available as a generic eye drop. And this is a medicine, it's an antibiotic to prevent infection. You'll use this drop 4 times a day for a week after the procedure is done. And we typically recommend breakfast, lunch, dinner, and bedtime. And in addition to written instructions, we actually have a handy little chart on the back of your instruction sheet that you'll get that you can go through and each day mark out the circles as you put the drops in. The other drop that we have you use is a steroid eye drop. It's for inflammation. It typically has a pink top on it. And this drop is also used 4 times a day, typically breakfast, lunch, dinner, and bedtime. With this one, you need to shake it really well. And when we talk about shaking the drop, we don't just mean lightly shaking it. I mean, give it a vigorous shake. It should come out milky white. If it comes out clear, you didn't shake it enough. When in doubt, shake them both, because you can't hurt the antibiotics by shaking them. And again, the chart for the steroid drop is here on the bottom. And again, it's 4 times a day. You can just mark out the little circles as you put them in. The day of treatment, surgery day, is day 1. So even if your treatment is late in the afternoon and you go home and take a nap and you don't wake up in time to put more than 1 or 2 drops in, that's still day 1. So the next day after will be day 2, and then day 7 is, if your treatment was on a Thursday, that would be the Wednesday after. That's basically it for your medication eye drops. We also have some artificial tears in your Lasik Plus Happy Meal. And with this, we have your party hat for the procedure. We have 2 boxes of preservative-free artificial tears, and we have a bottle of gel tears. Now, we want you to, with the medication drops, wait 5 minutes, putting 1 drop in, wait 5 minutes, and then put the next drop in. I frequently get asked, well, which drop should I put in first? And the answer is, I really don't care which one you put in first, but consistently put the same one in first, because inevitably you put one in, you'll be waiting that 5 minutes and your phone will ring or you'll get distracted, and then you'll come back and you'll be like, ooh, which one did I put in? So if you always put the same one in first and you mark the circle on the chart, then you always know what the second one's going to be that you have to put in. The Blink artificial tears that we have you use, a preservative-free tear is very easy to identify because it says preservative-free on the box and comes in these little individual dropperettes. Now, with the Blink tears, you can use these very aggressively. Putting these in every 20 to 30 minutes for the first few days is not an outrageous thing to do. The best practice is to twist the little top off the tube, put 1 or 2 drops in each eye, and if you push down on the tube, the little top will snap back down on, so you don't have to use the whole tube up right away. But try to burn through a tube about every hour to hour and a half the first few days, and probably every 2 hours for the first couple weeks after that. Another good tip is to put the tears in the refrigerator and put them in cold. It's very soothing. It also helps the swelling go down faster. Now, you may run through the boxes of Blink that you have in your kit. If you need to get more, you can always pick some up at the center, or you can always go to the drugstore. If you can't find the Blink brand, that's okay. Just make sure you get something that's preservative-free and comes packaged in these little individual dropperettes. That's the way you know a drop is truly preservative-free. And we'll want you using preservative-free tears for a couple weeks after the procedure's done. The last drop that you have to put in your eye, and I know there's a lot, is this gel tear. Now, this gel tear is a little bit thicker than the preservative-free tears, and it stays in your eye longer. The good news is it helps hydrate the eye better, but the bad news is it kind of blurs your vision up. So we have you put this in at bedtime. If you get up in the middle of the night, put some more in, and then do that first thing in the morning when you get up before you jump in the shower. This bottle should last about a month, so we just want you to use it till it's gone. And again, this is for use for hydration overnight. So The medication drops are 4 times a day for a week and then discard them. The artificial tears are very aggressively used for the first few weeks after the procedure is done, but you may continue to use them for several weeks to a month after the procedure. And then the gel tears are for overnight use, and again, you may use these for about a month, just use it till the bottle's gone overnight. That's pretty much the extent of the tear drops that you use. One other way that we help combat dryness is with our vitamin supplement called Hydra Eye. Now, Hydra Eye has 2 benefits. Number 1, it causes the glands inside of your eye to produce their own tears more quickly. And number 2, it has an anti-inflammatory property. And anytime you can control inflammation after a surgical procedure is always a good thing. With the Hydra Eye vitamins, a bottle should last you a month. You should take 4 of these a day. You'll take 2 with breakfast and you'll take 2 with dinner. Make sure you take them with food, because taking them on an empty stomach sometimes can not agree with you so much. So again, there's 120 of these in the bottle, so that should last you for 30 days. So that's a month's supply. And usually at that point, patients don't need them, but some patients, it has a lot of side benefits. So we've heard a lot of stories from patients about all the good things that this has done for them. So some people stay on it long term, and it's a good vitamin supplement. It can't hurt you. So that's basically the extent of the eye drops and the vitamins that you would need. Now, we do have a few things to be aware of. After the procedure is done, we do want you to go home and close your eyes and try to fall asleep. You can take Tylenol PM or something with an extra sleep aid in it. NyQuil is great, but we want you to try to rest. If you can't rest, at least lay down and close your eyes, because for about 4 to 5 hours, it can feel like you've got onion juice in your eyes, and your eyes are just going to water pretty significantly, and that's all normal, so don't be concerned by that. After about 4 to 5 hours, it's amazing. It's like someone automatically just kind of shuts off the faucet or flips the switch, and your eyes start to feel better, and you can open them and look around and actually see some of the miracle that that Lasik can create. And even then, your vision will still have a little bit of blur to it. And it'll get better as the evening progresses, and it'll be better yet tomorrow morning. But don't be concerned if for a few hours after this that you have some pretty significant burning, because that's very normal. You also, when you wake up from your nap or tomorrow, may notice some red splotches on the white part of your eye. We call those your eye hickeys from the procedure. And those are just some bruises, and it might take a few weeks to even a month for those to fade away. They don't affect your vision. They don't affect the health of your eye. They will start some conversations. People ask you what happened to your eye. So, but from its treatment standpoint and a healing standpoint, that's not a problem. Fluctuations in your vision are very normal, so don't be alarmed if some days are a little sharper than others. And if you're noticing an off day, 99% of the time it's dryness, so be more aggressive with tears on those days. But several days in a row of things getting worse, we definitely want to hear about that. Really try to avoid getting soap in your eyes when you're taking a shower. When you're washing your face, you wash your cheeks and your forehead, but don't wash your eyelids. Keep a towel draped over the shower door. That way you can kind of let the water run across and then just blot dry before you open your eyes. So straight in, starting tomorrow, is fine. We just don't want any side to side. For this evening, when you're tearing, please just blot your cheeks down below. Don't touch your eyelids. Again, we want you to stay away from there for that first 12 to 24 hours. Again, ladies, no eye makeup for a week after the procedure is done, and that's because you have to rub to take that off, and that could shift those flaps that we've created. Again, lots of glare and haloing at night is very normal at first. It's just the swelling from the procedure. As the swelling goes down, the glow and haloing around the lights will shrink. We don't have a lot of things that you can't do after LASIK. That's one of the beautiful things with this, is you can kind of get back to your life pretty quickly. There are a few things though, like I mentioned, no eye makeup after the procedure for a week, and 7 days is kind of a good rule of thumb. No swimming, no hot tubbing, no contact sports. We want you, if you're working out, you can work out in 24 to 48 hours, but just try to avoid getting sweat in your eyes. We all have bacteria on our skin, and that can carry down into your eyes and increase your risk of infection. So just be careful that you don't get sweat in your eyes if you're working out. Lifting, bending over, those type of things, that's not a problem with laser vision correction at all. We do have some emergency phone numbers. They're on your sheet. If you have something that happens that you have a question about during normal office hours, our office phone number is 614-269-4150. When you get the voice message, press 0. That'll roll you over to the front desk. If you have an after office hours emergency that you feel that it can't wait until the next day for normal office hours, you feel like if you don't get the question answered, you're going to go blind or might lose your vision, then we definitely want to hear about that. And the 1-800 number is here on your sheet that you'll take home with you. Again, we look very forward to having you as a patient. We're very excited to get to treat you, and let us know if you have any other questions. Any of the staff know. Thank you.